Hello and welcome to my YouTube channel Anatomy Mentor. Today I'll be discussing the histology of bone. Now, when we say histology, we mean we are going to be talking about its microscopic structure. And bone, it is also known as the osseous tissue. So our learning objectives for today's discussion are that we shall talk about the basic composition of bone and the histological features of cells and matrix that are present in skeletal tissue. Also, I'm going to be talking about the organization of bone. And then at the end of the basic discussion, we shall discuss the clinical conditions which are related to the bone, like osteoporosis and osteomalacia. So let's start first with the basic histology of bone. Well, like I told you, whenever we talk about any tissue, we have to separate it into the cells and then the matrix, that is the environment in which those cells are present. So bone is a specialized connective tissue and it is composed of cells and an extracellular bone matrix. This extracellular bone matrix is consisting of two parts, the inorganic material and the organic material. The inorganic material is that component of bone which provides it the strength and the rigidity, whereas the organic material is the part which is responsible for the flexibility of the bone. Remember, it constitutes 50% of the dry weight of bone when we talk about the inorganic material. And this inorganic material is mainly calcium phosphate, which is present in the form of the hydroxyapatite crystals. So this is the lengthy chemical formula for the hydroxyapatite crystals. But there are also some other ions such as the bicarbonate, magnesium, potassium, and sodium ions in smaller quantities within the bone. And other than the crystals, you also have the non-crystalline, that is the amorphous calcium phosphate. Collectively, they are forming the inorganic portion of the bone. And as I told you, it forms 50% of the dry weight of bone. Now coming to the organic material, this is also known as the osteoid. And this is the portion of the bone which contains proteins, mainly collagen type 1. Also, there are other types of collagen like 5, 3, 11, and 13. All the collagen molecules, they constitute 90% of the bone matrix proteins. But there are also some non-collagenous proteins that form the ground substance in bone, like proteoglycans with the glycosaminoglycans, like hyaluronan, chondroitin sulfate, and keratin sulfate. Glycoproteins like osteonectin and other bone-specific proteins like osteocalcin. Now let's talk about the types of bone tissue. Now, what are the types of bone tissue? Well, we can divide bone into two basic types, that is the primary and the secondary osseous tissue. Now, when we look at bone through the microscope, then we will see that there are the two types of bone tissue. That is, first, let's talk about the primary bone tissue. The primary bone tissue is also known as immature bone or the non-lamellar bone, also called the bundle or the Viven bone. Now, in this type of bone, the collagen fibers, which we just mentioned, they are going to be randomly present in the osteoid, that is the bone matrix. And this is the sort of bone which is found in fetal life and also in the initial stages of a healing fracture. Whereas the second type of bone, that is the mature bone, it is also known as the lamellar bone or the secondary bone. This is the one where the collagen fibers, they are arranged in a regular parallel pattern. You could say their arrangement is in the form of sheets, and this is the one which is formed in the healthy adults, right? So the secondary bone is the one which is found in healthy adults. And it can further be classified into two categories, that is the compact bone, and number two, that is the spongy bone. Spongy bone is also called the cancellous bone. Now let's talk about the bone architecture, which is arranged in a specific way to provide maximum strength for least weight. And there are two types of lamellar bone, that is the secondary bone, the compact bone I just told you, and then the spongy bone. When we say compact bone, remember that this is the one forming the dense, rigid outer shell, which is also known as the cortex, and this collectively forms about 80% of our total bone mass. Whereas in the inner aspect of bones is the spongy or cancellous part, which is consisting of thin, interconnecting, narrow bony trabeculi, also known as the medullary cavity, and this is forming 20% of the total bone mass. The space in the medullary part of the bone between the trabeculi is occupied by the hematopoietic bone marrow. That is the part of the bone which is going to produce the blood cells. So now we can look at a diagram of a typical long bone, and the middle portion, that is the shaft, is also known as the diaphysis, whereas the ends of the bone, they are known as the epiphysis. And you can see over here that the external aspect of this bone, this is the compact bone, also called the cortex, whereas the inner aspect is the spongy or cancellous bone, and over here it is surrounding this medullary cavity in the middle. Let's look at a closer picture of the spongy bone. You can see it literally looks like a sponge. So if you had a sponge and you were looking at all the spaces over here, so you can see and identify that this is the spongy or cancellous bone. You can see the spicules of the trabeculi arranged in the spongy bone. So spongy bone can be identified on gross examination, as well as the outer part of this bone where you can see is the compact bone that is forming the cortex. Now let's look at the diagrams which are showing us a comparison between these three types of bone. The immature bone, which I told you is the primary or the vivent bone. This is the one present in fetal life, also in the initial stages of a healing fracture. In this bone, you can see that there is no specific arrangement of collagen fibers. It does not display an organized lamellar appearance, and you can see that this is the immature bone. Now let's look at the mature bone, which is present in healthy adults. It is of two types, compact and spongy. Now in the compact bone, you can see over here that we have the collagen fibers which are arranged in a very characteristic organized fashion, which they are known as the lamellae. The lamellae are further arranged in these circular units, and each circular unit is known as the osteon and represents the structural and functional unit of the bone. And if we look at the mature spongy bone, here we also have the lamellar bone, but it is not arranged as osteons in comparison to compact bone. Over here we have the spicules, which are the interconnected trabeculi, and between them you can see are the spaces which are going to be present also in the living bone, and there you can see there is the process of hematopoiesis which takes place. Now, what about the cells which are present in bone? Remember, there are basically 5 types of cells in bone tissue. These are number 1, the osteocytes, number 2, osteoprogenitor cells, number 3, the osteoblasts, number 4, the osteoclasts, and number 5, the bone lining cells. So these are the 5 cells types which are found in the osseous tissue. Now, if we talk about these cells one by one, first we're going to discuss the osteocytes. The osteocytes are the mature bone cells. They have a long lifespan of about 10 to 20 years. So the cells which are primarily forming the bony tissue itself, they are the osteocytes. And these are flat almond-shaped cells that lie within small spaces known as the lacunae. And their numerous processes extend into small tunnels, which are called the canaliculi. And this allows a contact or communication between the adjacent processes of the osteocytes. Osteocytes, their processes communicate by gap junctions. Now, what is the organization of the mature or lamellar bone? I told you the basic structural unit, that is the osteon. It is also called the Haversian system. And the osteon, it consists of the concentric lamellae, which are surrounding a central canal, which is the Haversian or osteonal canal, and that contains the neurovascular supply. The canaloculi are arranged radially with respect to the haversian canals and they open into them, thus serving as a pathway for the transfer of substances between the blood vessels and the osteocytes. Now, the central canals of the osteons communicate with the bone marrow cavity and also with one another through transverse perforating canals known as the Volkmann's canals. And other than osteons, lamellar bone is also present at the inner and outer circumferences of the bone. And these are known as the internal and external circumferential lamellae, respectively. Between the osteons are remnants of previous concentric lamellae, which are known as the interstitial lamellae. So now we're going to look at all of these different parts of the bone that I just mentioned in a very simple diagram, which is showing us a section of the mature bone. And we can see over here that this is the portion in which you can see these are the osteons. So this is the part, the outer part of the bone, which is the cortex, that is the compact bone. This is a single osteon over here. This is another osteon adjacent to it. And you can see that each osteon consists of these concentric lamellae. Remember, they're made up of the sheets of collagen fibers. And also you can see that the outer surface over here, it is lined by periosteum. Just beneath this periosteum is also present the lamellae, which are forming the outer circumferential lamellae. And then are the inner circumferential lamellae, and then adjacent to that is the, you can see, like I told you, in the center of the bone, if it is a typical long bone, then you have the spongy bone, and then you have the medullary cavity. Now over here, if you look at a typical osteon, you can see in the center is a cavity, and this is the osteonal or haversian canal, which is in the center of this osteon. And you can see over here, this here is the haversian canal, and it is communicating with the adjacent osteons and outer and inner surfaces through these transversely placed Volkmann's canals. Also, let's look over here is the endosteum, which is adjacent to the medullary cavity. Now let's talk a little about this layer which I've just shown you, that is the periosteum. The periosteum is the dense fibrous layer which is investing the external surface of the bone, and it is further comprised of two layers, an outer dense connective tissue layer with small blood vessels, collagen bundles, and fibroblasts, and an inner cellular layer consisting of the bone lining cells, osteoblasts, and osteoprogenitor cells. And then what about the endosteum? The endosteum is present at the inner surface of bone, including the trabecula of cancellous bone, and it is a delicate layer, and it is very thin and also contains bone lining cells, osteoblasts, and osteoprogenitor cells. Now we are going to look at the H&E, that is the hematoxylin and eosine stained sections of bone or osseous tissue, and we're going to compare on the left the histomicrograph of an immature bone with on the right you have the histomicrograph of mature or lamellar bone. In an immature bone, you can see there are no lamellae, right? But if you look at the mature bone, you can see these lamellae, which are made of collagen fibers, which are arranged in the characteristic sheets. So in a cross section over here, you can see this here is an osteon consisting of concentric lamellae, and this osteon or haversian system, you could say, this is forming the basic structural and functional unit of bone. And in the center, it has this cavity or canal, which is known as the osteonal or haversian canal. Also, if you look closely at these lamellae, you can see that they are having these cells, which are the osteocytes, and these osteocytes, they are present within the cavities, which are known as the lacunae. Here again is a histomicrograph of the lamellar bone, but it is unstained, and we are looking at it by bright field microscopy. We can see very clearly this is one osteon, and here is another osteon, and then another osteon over here. So we can see several osteons which are forming the osseous tissue, and you can also see these nuclei of the osteocytes which are present amongst the lamellae of collagen fibers in a very sequential or organized fashion. They are present amongst the lamellae. And here in the center of each osteon, we can also see the central canal or the osteonal canal. Remember some important points whenever we are talking about the osseous tissue. Some points are to be kept in mind. The long axis of the osteon is usually parallel to the long axis of the bone. We saw this in the sections, and if you look at the longitudinal sections, then we will understand how the osteon is parallel to long axis of the bone. The second point to remember is that the collagen fibers in the concentric lamellae are laid down parallel to one another in any given lamella. So in a single lamella, the collagen fibers are parallel to each other. But the direction of the collagen fibers of adjacent lamellae, they are at right angles to each other. And this is the feature that is responsible for the strength of the bone. So we're going to look at this over here. We're going to understand this arrangement when we look at this diagram of a section of compact bone which has been removed from a long bone. You can see this portion over here. If you follow the laser pointer, this is the part which is the compact bone, and this over here is the spongy bone. Now let's look at the compact bone, which has several lamellae. These are the concentric lamellae of collagen fibers. Now, if you're going to open up a single osteon, this here is an osteon and this is the adjacent osteon, and here we have just simply opened up an osteon and we're looking at these lamellae. These are the collagen fibers. In a single lamella, the collagen fibers, they are parallel to each other, right? But if we compare the adjacent lamella, then the collagen fibers, they are at right angles to the collagen fibers of the adjacent lamella. This is the feature which imparts great strength to the bone. Also, you can see that this is the cavity in the center of the osteon. This is the osteonal cavity, which contains the neurovascular bundle. And adjacent osteons are connected by these transverse canals, which are known as the Volkmann's canals. Here you can see the periosteum on the outer aspect of the compact bone. You can also look at the circumferential lamella, the outer circumferential lamella. These are the ones which are not the part of the osteons. They're simply lying adjacent to the periosteum. And the inner circumferential lamella, they are lying adjacent to the trabecular bone. Now, this is a ground section of bone at a higher magnification where we are looking at an unstained section of a single osteon. And you can see over here, this is the single osteon. It has these concentric lamellae, which are containing the collagen fibers. And the collagen fibers within one lamella are parallel to each other. And between adjacent lamella, they are at right angles to each other. And this is the central cavity, also known as the osteonal cavity in the center of the osteon. And amongst the circumferential lamellae, you can see the osteocytes. So these are the nuclei in black over here, the darker stain. These are the nuclei. And remember that these osteocytes, each osteocyte is present within a cavity, which is known as the lacuna. And extending from these lacuna are the canaliculi, which contain the processes of the osteocytes. And you can see over here the processes of the osteocytes. And as I mentioned before, that through the canaliculi, these osteocytes are going to be communicating with each other. Their processes are going to be communicating with each other through the gap junctions, which facilitates the transfer of substances between the osteocytes. Now, when we're talking about the cells of bone, we discussed the osteocytes, which are the main cells, which are the basic cells which are forming bone. But there's some also other cell types present within the osseous tissue, such as the osteoprogenitor cells. Now, you know the name progenitor means that they're going to give rise to another cell type. They're themselves derived from the mesenchymal stem cells. They are found on the external and internal bone surfaces. They have the potential to differentiate into many cell types, including osteoblasts and bone lining cells. They are squamous cells, which means they're flat cells with lightly stained, elongated, or ovoid nuclei, and inconspicuous, that means less prominent, acidophilia, or a very slightly basophilic cytoplasm. Now, another cell type are the osteoblasts. When we use the word blast, we know that it is going to be a precursor to another cell type. So the osteoblasts, they are themselves derived from the osteoprogenitor cells, they have the function of secreting type 1 collagen, which I already told you that 90% of bone protein, that is collagen protein. And they also secrete other proteins as well as the unmineralized bone matrix known as the osteoid. Also, the osteoblasts have a role in calcification of bone matrix by producing the matrix vesicles rich in alkaline phosphatase, which raise the local concentration of phosphate ions. So their essential role is in bone synthesis. In the light microscope, they appear as a cuboidal or polygonal shape arranged in a single layer adjacent to the forming bone. Newly formed unmineralized osteoid, remember, it stains lighter in comparison to bone tissue, which is intensely eosinophilic, so osteoblasts appear to be separated from bone by a light band. Then let's talk about the another cell population which is present in bone, which are the osteoclasts. Now, whenever we use the word clasts, we mean it is having the function of destruction or removal. So what are the osteoclasts going to do? They themselves are derived from mononuclear hematopoietic cells. They are large multinucleated cells with marked acidophilia. They have the function of bone resorption, that is the removal of bone. They lie within cavities or depressions derived from the bone surface, and these cavities are known as the horseship lacunae. So here on the left is a diagram in which we can see these different types of cells in the bone. If you follow the laser pointer, we're going to first look at these cells, which are the osteocytes. They're present within the bone matrix, and each osteocyte is lying in a cavity, which is the lacuna of the osteocyte. And this here is the bone matrix in which these osteocytes are present. Now let's look at the outer inner aspects. We can see that these are the cells which are present over here, and these are the osteoblasts. Osteoblasts, as I mentioned before, are the bone forming cells. They are responsible for forming the bony tissue, and adjacent to them, this here is the newly formed matrix. You can see as the dotted portion is showing us the newly formed matrix, which has less acidophilia, that is the osteoid, which will then become mineralized in the later stages to form the adult bone. Amongst the osteoblasts, you can see these large cells which are multinucleated. These are the osteoclasts. Now, their function is opposite to that of osteoblasts, as the osteoclasts are going to be the bone removing cells. Also on the external aspect, we can see these mesenchymal cells. Now let's look at the stain section. Let's look at the histomicrograph of osseous tissue. And here we can see, now these are the osteocytes in the lacunae. This is the bone matrix. And here you can see is the osteoid, which is the unmineralized bone matrix. And you can see it is light pink in comparison to this darker acidophilic region. And then here you've got the osteoblasts, which are lining the bony tissue. And here are the mesenchymal cells. Now the osteoclasts we can see over here in this histomicrograph. These are the large multinucleated cells, and they're present in these cavities, which are known as the horseship's lacunae. And adjacent to them, you can see this here is the bone matrix. Now that we have discussed the basic histology of bony tissue, we are going to talk about some clinical conditions, the diseases which are related to bones. We are going to talk about the more important, the more commonly occurring ones. So first, let's discuss the abnormality in which the bone mineralization is defective. As I mentioned before, bone is consisting of an inorganic part and an organic part. Now, if the bone mineralization does not occur adequately, then this can lead to different conditions, different clinical conditions, such as now rickets. Rickets is a condition which is going to be caused by insufficient amounts of dietary calcium during growth, that is in childhood, or insufficient vitamin D, which is needed for the intestinal absorption of calcium. And this causes the condition in which the appearance is going to be, there's going to be a malformity in the bones of the legs, they're causing a characteristic bowing of the legs, and this is known as rickets, and it is reversible if it occurs in the early, if it is occurring in the early stages and you are giving vitamin D and calcium to overcome the deficiency, then this condition is reversible. If the deficiency of calcium, the dietary deficiency, occurs in a later age, that is in adulthood, it can cause a weakening of bones, which is called osteomalacia. Now, the word malacia literally means soft. So the bones are going to be soft, at a high risk for fracture, and there will be severe bone pain. Now, here we have an X-ray which is showing the bowing of the legs in case of rickets. And rickets is a metabolic bone disease. As I told you, there's a defect in mineralization of osteoid matrix caused by inadequate dietary calcium and phosphate, which occurs before the closure of the epiphysis. The patient presents with characteristic features such as you can see over here, the outward bowing of the legs, and the long bones are affected. Other than that, there is also the laxity of the ligaments, the bones become brittle, and there is enlargement of the costal cartilage. Another condition that is known as osteopenia. Penia itself means weakness. There is actually a decreased bone density, and this is based on the test which is done through the DEXA machine, and it gives us a T-score. Now the T-score, if it is from the range minus T1 to minus T2 or T2.5, it shows the osteopenia, that is the decreased density of bone, that is the bones are weak, they are going to be prone to fracture if the score is minus T2 or above. In the earlier stages, remember, it is reversible with exercise and also by taking supplements of calcium and vitamin D, and exercise should be the weight-bearing exercise in which the legs are touching the ground, such as walking, climbing stairs, or running. Then the other condition which you should be familiar with is osteoporosis. Osteoporosis typically occurs in postmenopausal women as the level of estrogen decreases and the osteoclast function, it is increased. And what happens is that causes increased resorption of bone. There's a decreased bone mass and making the bones more fragile. And of course, the risk of fracture would increase. But there are also other causes of osteoporosis, such as over here, in which there is severe osteoporosis in a patient with end-stage renal disease. You can see over here, these are the leg bones, and they have a characteristic moth-eaten appearance. By moth-eaten, I mean you can see the empty appearance of the bones, and you can see the widespread areas of radiolucency in both lower limbs in this condition, which is severe osteoporosis. Another condition which is a clinical condition related to bones is the osteopetrosis, which literally means marble or stone bones. Now, this is a hereditary disorder in which there is failure of the osteoclast to resorb bone. Now, if the bone is not going to be resorbed, it will become thicker and there will be increased bone mass, but the bone is going to be fragile even though there is increased bone mass. So let's look at the X-ray which compares the healthy bones with the infantile osteopetrosis. You can see this is the healthy thickness and density, whereas in osteopetrosis, the bones have become thicker and they have become more radio-opaque. Another clinical condition related to bones is osteitis fibrosa cystica. This is a rare complication of hyperparathyroidism. What happens is that the increased parathyroid hormone levels will increase calcium turnover from the bones, causing the fibrous tissue deposition within the bones, and the area of bone that has been lost, it gives a cyst-like appearance, as you can see in this X-ray, where you can see the tibia, and you can see over here the empty appearance, and there's also a brownish color discoloration because of the hemorrhage. And then again, the softening of the bones that can cause bone fracture. So remember that the normal metabolism of bone involves a balance between bone formation and bone resorption. And wherever this balance is disturbed, it can lead to different clinical conditions, different diseases of the bone, as we have just mentioned and we have discussed. And this concludes with today's discussion on the histology of bone. And if you found today's lecture helpful, And then please don't forget to like and subscribe to my YouTube channel, Anatomy Mentor. And I will also be sharing new topics. I'll be discussing different topics related to histology and also embryology and gross anatomy. So take care and best of luck with your exams and best of luck with your studies. Allah Hafiz. Goodbye.